You deserve healthy and good-looking legs. If you want to once again have attractive legs but have problems with spider veins or varicose veins, this video will explain the best treatment options, tell you what you can expect as an outcome, and answer the most commonly asked questions. Dr. Harry Schanzer is one of the world's leading authorities on the treatment of vein disease. He is frequently invited to lecture nationally and internationally on venous disease, its diagnosis and treatment, and Dr. Schanzer is often included on prestigious lists of best doctors and top surgeons. At the New York Vascular Laser Center, which he founded, Dr. Schanzer directs a complete vascular laboratory that enhances his ability to make an accurate diagnosis of your problem, and then, with that information plus a detailed examination, he is able to choose and execute the best treatment for your condition.
I am Dr. Harry Schanzer, and I would like to briefly explain to you how I can help you if you have problems with spider veins, varicose veins, or venous ulcers. Here, at the New York Vascular Laser Center, we have developed a vast experience in minimally invasive techniques to treat each of the three conditions. Diseases of the veins are complex. In order to treat you properly, a physician must understand the causes of the problem and then be able to choose from a variety of techniques the best one that fits to you. A doctor that only knows how to treat with one technique, being laser, injection sclerotherapy, or the common variety surgery, will not be able to provide the best treatment. At the New York Vascular Laser Center, we start by giving a detailed examination that includes a history, a physical examination, and an ultrasound Doppler test. With that at hand, we are able to understand the specific process in the patient, and then we can choose the best treatment for that particular patient. Now, let's review the most common questions that patients ask me when they come to this office for consultation.
What is the best treatment for spider veins?
The best treatment for spider veins is injection sclerotherapy.
With spider veins, how good a result will I get?
You can expect a cosmetic improvement of about 80%.
Will the result be permanent?
In some patients, spider veins may recur, and if that's the case, a simple retouching session will eliminate them and keep them on hold.
Will there be side effects?
The most common side effect is a slight brownish discoloration in the site of the injection that usually disappears completely after 3 to 6 months.
How do you decide what treatment to use for my varicose veins?
If you suffer from varicose veins, it is very important to determine if the condition is localized or if it's the result of a defect of the major vein that's called the saphenous vein. In order to differentiate between these two situations, it is very important to perform an ultrasound Doppler test. If the condition is localized, a simple injection will resolve the problem with excellent cosmetic results, it's painless, and you can return to normal activities immediately after the treatment.
What if I have defects in the saphenous vein?
If the problem is in the saphenous vein, it is essential to treat that vein in order to solve the problem of the varicosities. Some years ago, this was done with a surgical procedure that's called stripping, that consisted in removing the saphenous vein. This required general anesthesia, was done in the hospital. There was a painful recovery after surgery, and usually it took between 1 and 2 weeks before the patient could return to normal activities. We have developed minimally invasive techniques that, using laser, replace in 95% of the cases this painful operation.
What are the advantages of this laser technique?
The main advantages of this technique is that it's done in an office setting under local anesthesia with minimal pain, and the patient can return to normal activities usually the next day.
How is this procedure performed?
By placing a needle under local anesthesia in the saphenous vein at the level of the knee. Through this needle, a laser fiber is passed, and using ultrasound, the tip is positioned at the beginning of the saphenous vein. Now, the fiber is connected to a laser generator, and as the laser is fired, the fiber is slowly withdrawn from the saphenous vein, producing heat inside of it and closing it.
How much pain will I have afterwards?
During the first week after the procedure, you will have minimal or no pain at all, and usually an over-the-counter drug such as Motrin will suffice. In the second and third week, you may have a sensation of pulling in the area of the saphenous vein. That's the result of the laser effect on the saphenous vein. This usually is minimal and doesn't require any treatment.
What happens to my circulation once the vein is closed?
That's a very good question because patients are concerned very much about the vein disappearing. As a matter of fact, the vein, when it was malfunctioning, was not helping in the return of blood to the heart. Once the vein is closed, blood finds its way through one of thousands of normal veins in the leg, and actually the circulation improves.
What outcome can I expect from this technique?
95% of patients can expect to be free of varicose veins in the future. Let me finish by inviting you to visit my website, drschanzer.com, where you can find much more detailed information on the advanced treatments that we provide here. And allow me to reassure you that I have treated thousands of patients with similar problems like the one that you have. The results that you can expect are excellent. Diseases of the veins is something that you don't have to put up with. Just put it behind you and begin to enjoy a better quality of life.